You may think that the flu is just a slightly worse version of the common cold. Actually, the flu is a specific and serious respiratory disease and is typically much worse than the common cold. A cold may drag you down a bit, but a case of the flu can make you shudder at the very thought of getting out of bed. With the flu, symptoms generally occur abruptly. High fevers that last several days, in addition to body aches, fatigue, and weakness, can also occur. Complications from the cold are uncommon, but a severe case of the flu can lead to life-threatening illness such as pneumonia. Severe cases may cause hospitalization and may even lead to death. According to the website WebMD.com, up to 49,000 people die each year in the U.S. due to causes related to the flu, and over 200,000 are hospitalized due to complications from the flu. During a regular flu season, from October until May, about 90% of deaths occur in people 65 years and older. Unfortunately, just this week, a friend of the family passed away after a bout with the flu, and he was only 53. Currently, the best treatment for the flu lies with prevention, and the best way to prevent the flu is through yearly flu vaccinations. Now, if you've experienced the flu in the past, you know it's more than just the common cold. Next, I'd like to discuss two reasons why getting the flu vaccine every year is so important to our overall health. Currently, unless you are allergic to the vaccine, the CDC recommends flu vaccinations for everyone 6 months and older and for people at high risk for complications, those with chronic medical conditions and people working in the healthcare industry. Getting the flu vaccine can keep you from getting sick from the flu. The vaccine can make your illness milder if you do get the vaccine. Protecting yourself with the flu vaccine also protects people around you who are more vulnerable to serious flu illnesses, like infants that are less than 6 months old who can't get the vaccination, and people with certain chronic medical conditions are at a higher risk for flu-related complications. The flu vaccination has been associated with lower rates of cardiac events in people with heart disease. According to the CDC, the flu vaccine has been shown to be associated with 79% reduced hospitalization stays in people with diabetes and a 52% reduction for those with chronic lung disease. Those in the healthcare industry who take care of patients with chronic medical problems need to protect themselves and those that they treat. Vaccinations help protect women during pregnancy. It has been shown to protect babies for up to 6 months after they're born. One study showed that vaccinating pregnant women was 92% effective in preventing hospitalization of infants for getting the flu. Clearly, we can see why getting the flu shot every year is so important. Getting a flu shot every year is easier than you may think. Even if you don't have a family doctor, you can still get the flu shot. The vaccinations are offered at pharmacies, health centers, urgent cares clinics, and often at schools. If you are afraid of needles, a nasal spray vaccine is also available. It's not too late to get a flu shot. The typical flu season lasts between October and May. It takes 2 weeks after the vaccination for the antibodies to develop and provide protection. Getting the flu shot cannot give you the flu. The typical shot is made with a virus that has been inactivated and no flu vaccine virus at all. The nasal spray vaccine does contain a live virus, but it has been weakened and cannot cause severe symptoms. The side effects are sore throat. You need the flu vaccine yearly for 2 reasons. The body's immune response from the vaccine declines over time. Flu viruses are constantly changing and vaccinations are updated every year to cover the most likely viruses to cause illness. Now we can see it's easy and never too late to get vaccinated. In treating the flu, prevention is the best medicine. According to Munabi's article, millions of work days are missed due to the flu illness each year. That means that there's less income or sacrifice potential. You have to sacrifice your potential vacation days to make up for your absence. The flu vaccine can prevent you from getting the flu bug. It protects not only you, but those around you. According to the article by the American Academy of Pediatricians, there is as much as 60% decrease in the chance of children less than 6 months old of getting the flu when parents have been vaccinated. According to the article by Flannery, people with chronic medical conditions, such as those with heart disease, respiratory disease, and diabetes, need to be vaccinated for 2 reasons. One is it decreases hospital stays, and 2, flu-related complications, and it's been shown to decrease deaths due to flu-related complications. It is clear to see why yearly flu vaccines are important to not only you, but your family and others you have contact with. Unless allergic, everyone ages 6 months or older, people at high risk for complications due to chronic medical conditions, pregnant moms and people working in healthcare should all get the flu shot. Flu vaccination is the best way to prevent yourself and your family from getting the flu. If you are pregnant or thinking of becoming pregnant, getting the flu vaccine is the best way to protect yourself and your baby. As I have discussed, getting the flu vaccine is easier than you think. After listening to my speech, my hope is that I have educated you and convinced you to go out and get vaccinated. And now I'll take questions.
I got a question.
Yes.
Can I get the flu shot if I'm sick?
You should wait until your immune system is completely recovered. You should not get it when you're sick.
Over here.
Yeah.
Is it possible to get the flu from the shot?
No, the actual shot is an inactive virus, but the nasal spray is an active virus of the flu. You could get flu-like symptoms, but you won't actually get the flu.
All right, thank you.
Any other questions? I do have a couple things that I want to tell you guys. This here is some symptoms, try to tell colds apart from the flu. Fever, aches, chills, tiredness, and sudden onset. Usually with colds, you don't usually get a fever, but you do with the flu. It's very common to get a headache with the flu. You don't usually get a stuffy nose or a sore throat, but you do get aches and pains. And for those of us just out and about, this is just some statistics that on your desktops, there's 20,961 germs per square inches. So those of us that touch computers, that's how many germs we touch every day. That's why hand washing is so important. The mouse that we use on our computer, there's 1,676 germs on your mouse per square inch. And on your phones, 25,127 germs. So every time we touch our phones and then we touch our face, you know, we're exposing ourselves to more germs. And last but not least, this is just a picture that shows that the flu enters through the nose and it settles in the respiratory tract, and that's how a lot of the symptoms when we first start to feel sick, this is how they get in. So, thank you.